Since the Macula and Retina Institute specializes in treatment of afflictions and diseases of the retina, we asked Dr. Small to explain what the retina does.
Well, the retina is the light-sensitive tissue in the eye, and it has the consistency of wet tissue paper, and it's just gently laying in the back of the eye. And it's what the light is, the cornea and the lens in the front of the eye and the pupil and the aperture there are all structured to focus the light on the retina so that you can see clearly. Interestingly, the way the retina develops, it's very gently laying in the back of the eye, and the forces that hold it into place are actually fairly weak. It's actually, one way of thinking of it, it's like a bunch of little tiny Velcros that hold it into place. And so once you get a hole in the retina, or a tear in the retina, the fluid inside the eye can then percolate through that hole, and then the retina basically just floats off. And that's a euphemism for retinal detachment, which is a very serious, potentially blinding disease for a significant number of people, particularly people who are more nearsighted. Myopes are at an increased risk for this happening.
How do you know if you're experiencing a retinal detachment?
The symptoms for retinal detachment usually begin with a vitreous detachment, which are floaters, which are, most people see as little black bugs and worms and stuff in the vision. It's usually a fairly large number, like a shower of them, like a shower of gnats in the vision. The other symptom of a vitreous detachment and retinal detachment is flashing lights. And they're usually very brief little flickers of light in the far periphery. People usually only notice them when it's dark, when they're going to bed at night, or when they wake up in the morning and it's still dark. Realistically, these flashing lights are probably going on throughout the day, but it's bleached out by the ambient light. So the retina is a real dumb tissue. All it knows how to do is make light. It's a big phototransducer. And so if you mechanically stimulate the retina by pulling on it or poking on it or tearing it, it makes these flashing lights go off. There's no pain with the retinal detachment. There's no pain with tearing, and there's really no other symptom. And as the retina starts to detach, you then develop a blind area that corresponds to that area of detachment. And the retinal detachments typically begin in the periphery and move towards the center of the vision. Eventually they can cross over the center of the vision, and then you lose your reading vision, driving vision, fine detailed vision. And people can go completely blind fairly quickly, in a matter of a few days or weeks from a retinal detachment.
Is there any way to prevent a retinal detachment?
Well, preventing a retinal detachment, first and foremost, if you have a new onset of floaters or flashing lights, is to get in quickly and get a good dilated exam with a good examination of the peripheral retina. If there is a hole or a tear, then we can, and that's all there is, that's fairly easy to treat with either a laser or a freezing probe, a cryo probe. Typically we use laser nowadays to basically spot weld around that tear to prevent it from developing into a full-blown retinal detachment. Otherwise, there's some other high-risk activities that could be avoided, and certainly people who are nearsighted, myopes, should avoid these things, such as boxing, mixed martial arts, maybe bungee jumping, things that are jerking your eye around a lot or knocking your head around a lot is probably not ideal.
We wanted to know about the success rates for treating retinal tears.
Well, how successful is treating a retinal tear with laser? Basically, an untreated retinal tear has a 30% chance of going on to a full-blown retinal detachment. A treated retinal tear is about 1 out of 20. So basically you decrease your odds from 30% down to about 5%. And usually that 5% failure is because you develop a new tear somewhere else in the eye. As far as treating a full-blown retinal detachment, we have several ways of treating that. If the retinal tear and retinal detachment are in the upper part of the retina, we can treat that with a fairly small office procedure here called a pneumatic retinopexy, which involves injecting a gas bubble in the eye to float the retina back into place. For other detachments where you have to do a more formal surgery in an operating room, we go inside the back of the eye. It's sort of like arthroscopic surgery of the eye. We remove the vitreous jelly and the scar tissue that pulled the tear in the retina in the first place. And then typically put either a big gas bubble in the back of the eye, which acts as a splint to help the retina heal, hold it in place while it's healing, or silicone oil. And the success rate of that is around 95+% with one surgery. So 5% of people redetach and require subsequent surgeries.
For more information on Dr. Kent Small and the Macula and Retina Institute, please call their Glendale office at 818-552-5040 or their office in Los Angeles at 310-659-2200. Or you can visit their website, maculaandretinainstitute.com.